My name is Isela Vasquez. I'm an MD. I've been a general surgeon in practice since 2010, and I've been board certified since 2011. I am originally from Brownsville, Texas. I grew up there, and I went to undergraduate in Houston, Texas, then medical school in San Antonio. I did my general surgery residency at St. Louis University in St. Louis, Missouri. I decided to become a doctor probably as an undergraduate. I always liked science in school, and when I went to do my undergraduate degree, I was majoring in biology. And I actually considered doing basically lab work, which is basic science biology. But I found that I really missed the human interaction that you don't often get in those types of scenarios. And that's when I decided to become a medical doctor. What drew me to general surgery is actually multiple things. When I first started medical school, I actually thought I wanted to be a family practice doctor. And really that's because that's really the only type of doctors I interacted with as a kid. And then when you do medical school, the first 2 years are basically, sitting in a classroom. And then the third and fourth years is when you really get to see the different specialties and interact with patients. And what I found is that general surgery kind of fit my personality. I like to, when I see a problem, try my best to fix it. And that's really what general surgeons do. When I came out of my surgical training, which is in 2010, the majority of the cases I was doing were either open or laparoscopic, and both of those are good procedures to do and patients do well. Since about 2019, I would say I've been doing more robotic surgeries, and that confers a lot of advantages both to the patient, most importantly, but also to the surgeon. For the patient, what we see in robotic surgery is oftentimes shorter recovery. Oftentimes you can also avoid a stay in the hospital, and for the patients that do have to stay in the hospital, we see a decreased length of stay. And for the surgeon, there's some ergonomic advantages as well. It's very important for me to have the patient family involved because the family obviously is going to be your main caretaker for when you go home. And they need to be aware of what to look out for, but also, your limitations as far as what you can do after surgery and in the long run. What I would like for patients to know about me as a physician is that I really talk to the patient, hear what their concerns are. Not every patient has the same concerns regarding different disease processes. I have some patients who really are most concerned about returning to work as soon as possible. I have other patients who are most concerned about pain. I have other patients who are most concerned about, recovery time in the hospital. So those are all things we need to discuss to see what might be the best procedure for you, and so that you're well informed about the future.